Yeah, just a quick review of the GARNO knee brace. So this brace is made specifically for people that have having some type of knee pain or some type of knee problems. The idea here is that you put on the brace and it supports your joint and the surrounding soft tissues around the knee. It restricts knee motion a little bit, and that way your knee has a chance to rest, recover, and doesn't get so overstressed as you're doing various activities. So a few points about this particular brace. It does have two removable pads on the inside, so you can actually take that off and move them around wherever you want to, which is kind of nice to kind of customize it a little bit. The other thing to know about this brace is it is hand wash only. So you can't really take it and throw it in the washing machine, stuff like that, which can kind of be a big deal to some people, especially if you use it a lot, you get sweaty, especially in the summer months, then you're going to have to think about washing the thing. And some people just aren't crazy about hand washing stuff. So if that bothers you, kind of look for one that you can just throw in the machine. But yeah, other things you can do for your knee besides a brace, just a few examples here from this resource, Bulletproof Your Knee. If you have any kind of knee trouble, make sure you're definitely strengthening your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg. And here's a picture of it. So this is your quadricep muscle. Here's your kneecap or your patella for reference. What they're finding now is that probably just about any knee problem you can name, I can probably show you a study showing that you probably have some problem with your quadriceps muscle as well. And your quadricep muscle is a big stabilizing muscle. So it has to be 100% to get your knee fully functioning to stay out of pain. So you want to make sure you keep it strong. Problems they're finding, it's usually most of the time it's like weaker than normal with various conditions. The other thing, some studies are actually showing that it's smaller than normal when they look at it on CT scans and they look at the cross-sectional area of the muscle. Here are a few examples. Knee swelling in the quadriceps. Another study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, now that's just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of knee swelling, it's probably taking its toll on your quads, and you need to get it stronger for sure. Knee injuries in the quadriceps, any kind of for instance, fractured your tibia, your lower leg bone, surgical opening of the knee, any kind of knee surgery where they opened your knee up, put you at risk for having quadriceps weakness. Here's a good ligament problems in the quadriceps. Anterior cruciate ligament, that's also known as your ACL. So here's a good example. People who had completely ruptured their ACL, 25 to 30% decrease in quad strength. So, you knock the quads down that much, you're really compromising knee stability, and then you run into other problems. Kind of hard to get pain-free if you don't have that up to 100%. Posterior cruciate ligament, same thing, another ligament around the medial collateral ligament. I mean, it takes a hit. The quads definitely when you have problems, if you tear them or that kind of thing, rupture them. Knee pain in the quadriceps. They show you that if you have any kind of chronic knee pain, then it can definitely decrease your quadriceps strength. Here's a good knee arthritis in the quadriceps. So actually there's tons of research showing, if you Google it, knee arthritis and quadriceps. And basically it's pretty much set in the literature that if you have knee arthritis, you probably have some weak quads. Likewise, there actually are some randomized controlled trials showing that if you take groups of people with knee arthritis and you just strengthen their quadriceps muscle, that their knee pain starts to go away. And more interestingly, they also find that the stronger your quads are, the less progression of your knee arthritis there is. So you have a lot of reasons to keep your quads strong if you have knee arthritis. Patellofemoral pain syndrome, and the list just goes on and on. So if you have any kind of knee problem, make sure you're strengthening at least do one exercise for your quadricep muscle. Step to fine-tune control over your knee. Here they're talking about the hip. There are some knee problems. You'll have knee pain, but the problem really has nothing to do with your knee. It actually has to do with your hip is where the source of the problem is. Classic example is the iliotibial band syndrome. If you take a group of people with iliotibial band syndrome, you test their hip abductors, you find they're unusually weak. Likewise, here again, the randomized controlled trial showed you take a groups of people with iliotibial band syndrome, you strengthen their hip abductors, and then the iliotibial band syndrome goes away. So definitely something you want to look at. Optimize knee flexibility. Well, we all know that you have to have a flexible knee. It needs to bend and straighten. What a lot of people don't know is that your knee actually rotates. About the last 10 to 15 degrees of extension, that's you straightening your knee actually laterally rotates out to the side. Here's a little test to see if you have that accessory motion. So you're going to need that accessory motion to have a fully functioning knee. Other things you can do, increase dynamic knee stability. So here they're talking about proprioception. So if I turn the lights out all of a sudden, you probably could tell me whether your knee was bent or straight, right? So that's your proprioception, your position sense. And that happens because you have joint receptors and receptors, nerves in the muscles that give your brain constant feedback as to where your knee is in space. What they're finding now, they get looking at people with knee pain and certain knee problems, they find that they actually have decreased proprioception. So it's not like you don't know where your knee is or anything, but it's not up to where it's supposed to be, which can influence things like, let's say if you step off a curb, you know, you need that reaction time. You need to know where your knee is to react and stabilize it, that kind of thing. So yeah, lots of stuff you can do. But hey, nothing's as quick as putting on a brace. A lot of people put on a brace and their knee pain goes away right away. So good brace, check it out.